In this video, I'm going to try something different. I'm going to talk about treatment of an illness, specifically depression. I'm going to talk about what depression is, what it isn't, a little bit about drug treatment for depression, treatment of severe depression, treatment of mild to moderate depression, and I'm going to focus on non-drug treatment of depression, not psychotherapy, things that you can do on your own if you're suffering from depression that will help. Hello, I'm John Foster. I'm a medical doctor who does Social Security disability exams, and as usual, everything I say reflects my own opinions based on my own experience and study, and not the opinions of the Social Security Administration or any other medical body. Now, these days, it seems like everyone and their Aunt Fanny claim to have a mental illness, or more than one mental illness, and are all taking psychiatric medications. And that's ridiculous, in my opinion. There is serious psychiatric illness, but we have a very skewed opinion of mental health and mental illness these days. Sadness and worry are part of a normal life. No one gets through life without periods of sadness and worry. That doesn't mean that we're all mentally ill and all should be on psychiatric medication. And that hasn't been the case since the beginning of time. It's been the case for less than 70 years, which is about the time when effective psychiatric medications were first introduced in the United States. The first was chlorpromazine, which was the first drug treatment for psychosis, what we laymen call insanity, most commonly schizophrenia. The second was imipramine, the first antidepressant approved in the United States in 1959. Prior to that, there were no antidepressant drugs. Then, in 1987, fluoxetine, brand name Prozac, was the first SSRI antidepressant approved in the United States. Finally, lithium carbonate, an effective treatment for bipolar illness, better called manic depression, was only approved in 1970. Prior to that, there was no really effective drug treatment for manic depression in the United States. So we've seen a huge increase in the use of psychiatric drugs. Now, together with that, many effective treatments that were used before these drugs became available for the treatment of mental illness have been forgotten or left by the wayside, but they're still effective. And if a person's on psychiatric drugs, they can help. If a person's not on psychiatric drugs, they can help. So what is depression? Well, depression and sadness are not the same thing. Feeling sad is part of depressive illness, but it's not all. To be classified as depression, the person also feels hopeless, that nothing that happens will improve their situation, and their situation will just get worse and worse. And also, they have to feel helpless, that there's nothing they can do or anyone else can do that will improve their condition. Let me give a theoretical example. Suppose you have an unexpected car breakdown and find out you have to pay $2,000 for repairs. You're going to be sad, but a normal person will be sad for a while, but they'll realize that something can be done about it. They can get their car fixed. They might have to put the charge on a credit card and pay it off over months. They might have to take some extra shifts at work. but it's not a helpless situation. However, if the same person took to bed, had trouble getting out of bed, stopped eating and began losing weight, stopped going to work and was fired, and was considering hurting themselves or ending their life, that would be depression. So, depression is a persistent sad mood with feelings of hopelessness and helplessness. It may be what we call endogenous, which means that it comes on for no apparent reason, just out of the blue, or it may be reactive, where something comes on that would cause a normal person to feel temporarily sad, but get over, but the depressed person just gets worse and worse and can't get over it. Reactive depression is brought on by a real issue, but the person's reaction to the issue is way more severe and out of proportion than the issue really merits. Now, because everybody these days says they're mentally ill and are on psychiatric medication, a lot of people dismiss mental illness as nothing serious and nothing to worry about. And that simply is not the case for real depression. A real depression is about as dangerous as a heart attack. They have about the same risk of death. In the United States, there are about 50,000 suicides per year. It's one of the top causes of death in the United States. And about 3 times as many people, about 150,000 per year, attempt suicide but live. Also, depression, when in its most severe form, can be psychotic. The person can be so depressed that they are insane. And depression is not only a risk to the life of the person with the depression, it can be a risk to the life of their young baby, as in the case with severe postpartum depression, or the person's family members, or even their personal pets. During the great financial crisis of 2008 to 2009, I frequently heard in the news of a man who'd killed his family, often killed his dog, and then killed himself. There are no other illnesses where the illness can result in the deaths of others. So, let's talk about suicidal depression, the most dangerous type of depression. And if you're feeling suicidal, help is available. I'm going to put the number for the suicide hotline in the description of this video below. People who are suicidally depressed are best off in the hospital. You can go to any hospital emergency department. Emergency doctors are very familiar with depressed and suicidal patients. I did 27 years of emergency medicine, and I saw many, many depressed, suicidal patients, and some who'd attempted suicide. Any emergency department will take care of you. Now, something not everyone knows is that some hospitals have psychiatric wards and some don't. Some hospitals don't have facilities for treating psychiatric patients. However, all of the emergency departments of hospitals without psychiatric wards have plans and procedures for transferring people who need psychiatric admission to a psychiatric facility. So you don't have to go to a psychiatric hospital or a hospital with a psychiatric ward to get help if you're suicidally depressed. Now, with suicidal depression, once the person's in the hospital, it's best to begin an antidepressant drug. But antidepressant drugs take a while to have effect. It can take up to 2 weeks. And sometimes you don't have the time to sit around twiddling your thumbs for 2 weeks. The patient's in too great danger. There are 2 rapid treatments for severe depression. One is electroconvulsive therapy, which is astonishingly effective, and the other is a drug called ketamine, which I don't have experience with, but is also reported to be astonishingly effective very rapidly. Now, one other thing. If you know someone who is suicidally depressed, a friend or a relative, if possible, take them to the hospital. If they absolutely refuse to go and you really think there's a danger, the best thing to do is to call your local police department. The police will come out and see the person. They won't arrest them, but they can bring them to the hospital against their will if that's necessary. At the hospital, the person will be evaluated, usually in the emergency room. In my experience, most of the time, I was able to persuade people to go into a psychiatric admission if I felt it was really necessary. But if they absolutely refused and I thought the danger was great, I was able to involuntarily commit them for psychiatric treatment. All 50 states have a procedure where a doctor can commit a person for involuntary psychiatric help. It's different in every state, but it's pretty much the same thing. Now, that's severe, dangerous depression. What about the more common mild to moderate depression? Well, first of all, I think in most cases, the person should try antidepressants. Now remember, it takes about up to 2 weeks to see if the drug's going to have any effect. Suppose you take an antidepressant for 2 or 3 weeks and you find no effect. At that point, I would switch to a different class of antidepressant. There are several different classes that are quite different, and someone who doesn't get better on one may get better on another. If you've tried 3 classes, however, and you find no help, I think it's time to stop. There are quite a few people who don't seem to benefit at all from antidepressants, and there's no point in taking drugs that don't work. However, the reported effectiveness of antidepressants is very low, only about 1/3, and I think that's spurious. I think what's happening is that in many cases, antidepressants are given to normal people. And here's something to think about. Giving a drug to a person who's normal is not going to help and might make them worse. Suppose you're a normal person and I give you penicillin. It's not going to make you any better, and you might have an allergic reaction and be worse. On the other hand, suppose you had a bad strep throat and I gave you penicillin. You would get much better. There's still the risk of an allergic reaction, but that risk is worth it for the benefit you get from killing the strep germs. The next thing for mild to moderate depression is some kind of therapy. And here I want to talk a little bit about cognitive behavioral therapy, which has become very popular in recent years. And I think it has some advantages, but I also think it has some disadvantages and can be a scam. The original therapy was psychoanalysis, invented by Dr. Sigmund Freud in the late 1800s. And that involves the person going to the psychiatrist 2 or 3 times a week for an hour at a time for between 2 to 5 years. Now that's a huge commitment of time and resources and is very expensive and really can only be afforded by rich people. It is effective, but it's kind of been abandoned mainly because of the cost. Less intense psychotherapy usually involves seeing a therapist once a week for about 45 minutes to an hour for several months to a year or so. Cognitive behavioral therapy involves only seeing a therapist for about 4 to 6 sessions once a week, and all sorts of claims are made about how superior it is and how it can cure just about any psychiatric illness within only a few sessions. I believe that a big driver of this is healthcare insurance companies who do not want to pay for extended psychiatric care. Yes, I believe cognitive behavioral therapy is all some patients need, but it certainly isn't all some patients need, such as a person with schizophrenia, which is a lifelong disease with no cure. It can't be fixed in 6 sessions. Now, let's talk about things that you can do on your own that will help with depression. And the first is easy and free, and it's sunlight exposure. Exposure to sunlight outdoors, preferably when it first gets bright in the morning, about 8 a.m. or 9 a.m., say, for a minimum of 20 to 30 minutes, will improve depression. The second is exercise. It's amazing, but exercise has now been proven to help all mental illnesses, from the mildest depression to the most severe psychosis. One of the things that we've lost is exercise for hospitalized patients. Back in the 20s and 30s and 40s, before the psychiatric drugs were invented, it was normal to have psych ward patients go outdoors where they were exposed to the sun and exercise in a group exercise class every day. I am not aware of any psychiatric treatment facility that does this anymore, but it works. Interestingly enough, as I've said before, I run an exercise class for cage fighters, and I had one this morning, and the fighter I was training came in all down and unhappy, not happy that he had to be there, and we had a brutal exercise session. One of the things he had to do was put on a weighted vest, do as many push-ups as he could, then get about a 10-second rest, then again do as many push-ups as he could, get a 10-second rest, and for a third time do as many push-ups as he could. I was doing the same thing, but without the weighted vest. And after an hour of brutal exercise, his mood was much improved. He was cheerful. It was a big difference. Now, the final thing you've probably never heard of before, but one thing I learned from Dr. Jordan Peterson is that thinking about yourself and your problems is no different from being depressed. And depressed people tend to ruminate. They tend to think over and over and over again about themselves and all the problems that they have. And the best way to break out of that vicious cycle is to help others. There are always people less fortunate than you, and you can do something to help them. Even if you're bedridden, you can answer a helpline on the telephone for people, for example, who are in a crisis. I have a tendency myself towards melancholia. And one of the things that cheers me up, sometimes moderately, sometimes extremely so, is helping people with medicine. I could talk for an hour about the 7-week-old baby whose life I saved by doing mouth-to-mouth resuscitation. And even though it was back in the 90s, it still brings me joy to think about it today. Perhaps I'll do a video on that one of these days. The final thing, people who are depressed tend to have tremendous problems with motivation. Going outside and sitting in the sunlight may be something they're capable of, but exercising and helping others may be a real stretch. If you are suffering from depression, I would suggest, if possible, you enlist the help of a friend or relative and have them push you, get you out of bed, get you off the chair, get you to the exercise class, get you to your volunteer session with the homeless, etc. Tell them that it's okay to be rough with you and force them if need be. Well, I hope this has been helpful. Let me know if you found this interesting or not, and as always, remember, if it happens, it's possible. Hello, I got your food. Here we go. Here we are. Here.